When it gets hotter, we see violence rates rise, increased emergency room visits, hospitalizations related to cardiovascular disease, related to diabetes, electrolyte imbalance, renal failure, respiratory outcomes. And I could go on and on when we talk about this. And we, of course, know that these heat-related health impacts are greatest among children, adults over 65, people with disabilities, people with mental health or substance abuse disorders, pregnant people, and people who have lack of access to cooling, okay, as well as outdoor laborers.
Welcome to Policy for the Planet, a new bi-monthly podcast exploring the global response to the climate crisis. I'm Monica DeBoll, a best-selling author and senior fellow at the Peterson Institute for International Economics based in Washington, D.C. My work bridges the fields of economics, science, public policy, and public health, all under an international lens. In each episode, I speak in depth with experts to understand how governments are responding to the monumental challenges of the climate emergency. We'll unravel the complex trade-offs of different policy choices to steer us towards sustainable practices and public well-being. Welcome to the conversation. As weather patterns shift and extreme events become more frequent, public health will inevitably be impacted. Joining us today is Dr. Mary Hayden, a behavioral scientist and research professor at the University of Colorado's Lyda Hill Institute for Human Resilience, affiliate scientist at the National Center for Atmospheric Research, and adjunct faculty at the Colorado School of Public Health. She currently serves as a member of the board on environmental change and society at the National Academies of Science, Engineering, and Medicine, and was the lead author on the Human Health chapter of the 5th National Climate Assessment. Mary's interdisciplinary work integrates physical and social sciences to shed light on how climate change impacts human health, with a focus on vector-borne diseases such as dengue fever and Lyme disease. Today, she shares the far-reaching implications of climate change on public health and discusses strategies for building resilience in the face of these growing challenges. Welcome to the show, Mary. I am very excited to talk to you about climate and health, and specifically the health implications or the health consequences, I should say, of climate-related issues, climate change, and all the things that we have been going through. So on that note, I'd like to start us off by asking you to please tell us about the connections between climate change and health, from excessive heat to the spread of mosquito-borne and other diseases, which is an area that you have dedicated your life to. So thank you very much for being with us.
Well, and thank you, Monica, for inviting me. I'm very excited to be here today. So I want to just start out by saying climate change is harming human health. And when we think about it, we often think, oh, it's just physical health. Okay, just, but not just. But it isn't. We're seeing negative impacts from climate change on mental health, on spiritual health, and community health and well-being. And we see this because we're seeing so many climate-related weather events that impact the U.S. population. And this includes floods and droughts and wildfires, extreme temperatures, and as we all know from recent events, hurricanes, right? And different kinds of storms that we're seeing. And unfortunately, with climate change, all of these are expected to increase in frequency, in intensity, and in extent. So we're going to see them over a larger area in the United States as well.
It is difficult, isn't it, to get people to be attentive to the health implications of climate change, to get them to understand that climate change is a health issue, is it not?
Yes, absolutely. And with the health risks that we can expect from climate change include higher rates of heat-related morbidity and mortality, for one. And we've seen that with the extensive heat we've had in this country in recent years. We're experiencing increasing geographic range of some infectious diseases. We're seeing greater exposure to poor air quality, whether it's from wildfires or air pollution in cities. We're seeing increases in adverse pregnancy outcomes, higher rates of pulmonary, higher rates of neurological, higher rates of cardiovascular diseases, and worsening mental health in response to all of these problems we're facing.
So, in other words, we're kind of seeing the gamut of diseases in a sense, because we're seeing a rise in non-communicable diseases. So,
Mhm.
cardiovascular, respiratory issues, and so on, as you said. On the other hand, we are also seeing an increase in infectious diseases, and you've devoted a lot of your research to precisely that question, looking at the spread of some infectious agents, like, for example, Lyme disease and dengue
Mhm.
fever and other diseases that are infectious in nature and caused by pathogens. And then on top of all that, there's the mental health issue, which is
Right.
obviously huge. And we can already see exactly where that would come from, because if everyone is going to be subject to these enormous shocks and these enormous dislocations caused by climate change, that, of course, is going to add on to the toll of anxiety disorders and depressive disorders and you name it, right? So it is really the full gamut of when we're talking about public health, individual health, it is everything. It basically affects it all, right?
Right. Absolutely. And I just want to mention that those risks that I talked about, they have an effect on every single person in the United States, but they have disproportionate effects on communities that have been under-resourced and overburdened. And individuals such as pregnant people, communities of color, children, for example, we're seeing such mental health issues in children, people with disabilities, people who are experiencing homelessness. And of course, we mentioned the chronic diseases and older adults. So you could really say that climate change is a threat multiplier. I mean, we often hear this in military terms, but climate change is the same thing. It interacts with and it magnifies other life threatening stressors. So, for example, when we talk about fence line communities, and these are communities that are located adjacent to hazardous industrial facilities. And of course, they're disproportionately BIPOC and low wealth communities. And these communities all face higher risks from chemical and from industrial disasters when we see extreme weather, because often these are disruptive. So, for example, in Colorado, when we see floods, we often see our waste facilities are inundated with water, and they're not able to clean and do what they need to do, all of our water facilities. And we also know that about 70% of Superfund sites, so these are locations that are already contaminated by hazardous materials, they're located within 1 mile of federally assisted housing. And of course, these houses are usually and disproportionately inhabited by people of color, individuals with low wealth, and persons with disabilities. So we're seeing all of these communities that are facing even more extreme issues when it comes to climate.
So, in other words, it's a threat amplifier, as you very well put. But on top of that, it's a threat amplifier for particular groups within society and particular groups within the US population. And those are exactly the groups that are most vulnerable to begin with. So, it's the elderly, it's minorities, it's people who are living in precarious conditions, people who are homeless. Those are getting hit the hardest. And in the end, it provokes massive social dislocation on top of the social dislocation that already exists. So it is
Yeah.
really an existential issue, as in, how do we survive? Because we're talking about health, we're talking about living conditions, we're talking about water, we're talking about air, all the things that are vital to keep us going.
Right. And we really need to focus on this. We need to focus on creating climate resistant health systems. We need to focus on adaptation measures. And we need to focus on mitigating greenhouse gas emissions if we're going to protect human health. And we really need to. And I'm thinking that later on down the line, when we talk about other things, I'd like to give some examples of ways in which we can do this. So,
Perfect. So I'm going to ask you, though, before we do that, to talk a little bit about the research that you've done on the infectious disease side. So specifically Lyme disease and dengue. So if you can please talk about that and your findings pertaining to the US, because you have a lot of interesting findings in your research.
why, thank you.
And then we can move on to, well, there are so many topics for us to cover, because I'm very interested in hearing also about your work on overheating and, the extreme temperatures and what that implies for public health in the face of climate change, as well as the other issues that you've just mentioned. So there are a number of things for us to talk about: pandemic preparedness, climate change and pandemic preparedness, funding for health and pandemics and climate change, which are all interconnected, cooperation and coordination between countries. So it's endless, right?
Yes.
There are so many issues. Let's start with the infectious disease angle, if we can.
Sure. And thank you for asking. Of course, this is near and dear to my heart. And Lyme disease has been nationally notifiable as a disease since 1991. And we've been seeing an increase in not just the cases, but also the geographic range of the vectors of Lyme disease, as well as an extended season for transmission. And we call that the shoulder season. So we see it starting earlier in the year and going longer in the fall. So extended season for transmission. And we've seen a steady increase in Lyme disease and other tick-borne diseases actually over the past 20 years due to climate change, but also other factors such as land use change. I mean, I don't want to just pin it all on climate change because there are multiple factors that come into play here. But estimates for Lyme disease in the US are in excess of 400,000 cases annually. These are clinical cases, okay? So these are not lab reported cases, but clinical cases estimates. And approximately 80% of all reported cases of vector-borne disease in the US are tick-borne diseases. So really,
That's a very massive number.
yes.
It's very eye-opening.
Yes.
And what about dengue, Mary, and other mosquitoes? So moving from Lyme disease and tick-borne diseases to mosquito-borne diseases, we are also seeing a spread and a dissemination into areas that were not previously endemic of these diseases, right?
Mm-hmm. Absolutely. And we see many reasons for the expanding range of these disease vectors. And climate change is, of course, one. But unplanned urbanization in many parts of the world where we see unregulated settlements, inadequate municipal services. People don't have piped water, so they have to store their water, which provides a perfect breeding place for these mosquitoes. We see there's a lack of or very limited trash collection. And with the proliferation of plastic, so these non biodegradable receptacles, even bottle caps provide a place for the mosquitoes to breed. And so we're seeing all of these, including land use change, that are problematic. So in the US, what we're seeing is that climate change is altering the diversity and distribution of mosquito vectors, and particularly those mosquitoes that transmit dengue, Zika, and chikungunya viruses. One of the more interesting ones, I think, is Aedes albopictus, which was introduced through the used tire trade from overseas into Louisiana in 1985. And now we see the Asian tiger mosquito, as it's known, has spread all the way north, as far north as Maine, all the way west into Nebraska, and we're seeing it on the West Coast. And this is a mosquito that thrives in the tropics, in the subtropics, and also in temperate zones. So it's very, very difficult to control this because it's also a container breeder. And as I mentioned earlier, a bottle cap will serve just fine as a mechanism for the mosquito, which the mosquito to lay its eggs and to the larvae and pupae to survive. And Aedes aegypti, which is the yellow fever mosquito, and one that's been around for a long time. It was responsible for yellow fever outbreaks as far north as Philadelphia in 1700s. So I think it was 1793 that was an outbreak in Philadelphia that killed over 5,000 people. So, and we're now seeing the northward spread of Aedes aegypti in California. There was just a recent report. It spread into Santa Clara County, which is in Northern California. So dengue continues to be a risk in the contiguous United States, in the U.S. Caribbean, Hawaii, U.S. affiliated Pacific Islands. We've actually seen 11 locally acquired. That means that nobody traveled. When we talk about locally acquired, we call it autochthonous, meaning there was no travel history associated with these cases. 11 locally acquired cases of dengue in California, 9 of which were in LA County. We've also seen 49 cases in Florida this year throughout parts of southern Florida. Last year, we saw 178 cases in Florida, all locally acquired. And of course, there are many, many, many more cases. One of the things that's interesting about this is that 75% of the people who have dengue are asymptomatic. So we don't even know that they have dengue. And so we probably have a lot more local cases than just what we see from the symptomatic people.
And that's a complicated issue in itself, right? Because the asymptomatic people with dengue could eventually, if they catch dengue a second time, depending on the serotype on the virus, the dengue virus, there are 4 types of it, as we know. And depending on the virus they caught the first time, if they catch a different one the second time, it can cause greater health problems than what a patient has the first time around, which is something that I guess not many people know about dengue, but it is a characteristic of this disease and makes it very complicated. Chikungunya has its own issues with the effects on babies and on pregnant women and all the problems related to that. Yellow fever, of course, is its own thing. There's a vaccine for yellow fever. There's now a vaccine for dengue, but it's complicated because you can't really, not everyone is eligible to get that vaccine. And some candidates are still undergoing clinical trials. There is one vaccine that has already cleared all of that, but it's complicated. So we really need to deal with the problem of the spread of these infectious agents, in the United States now. And I guess, I don't know, the impression that I have, and I'd like to hear you because you're the expert, is that there is concern, there is awareness, but is that enough? Like, is there enough concern and awareness and a sense of urgency for dealing with these things? So, Mary, we know that these vector-borne diseases and these mosquito-borne diseases, tick-borne diseases, and so on are the rise in the US. They're spreading, they're moving north, they're moving to areas where they previously weren't present. The mosquito, as you said, is very difficult to eradicate. It's not impossible. Aedes aegypti is everywhere. And countries in other parts of the world have been trying to get rid of this mosquito forever, and they have not been able to do that. So the diseases that are transmitted by ticks, certain types of ticks, certain species of mosquitoes, like Aedes aegypti, they're really concerning. They are serious illnesses. Dengue fever can be very serious because for people, as you said, there are asymptomatic people out there. But of course, we know of dengue that there are 4 different types of the virus. And if one person has an asymptomatic case of a certain virus and then catches a different dengue virus a second time, they can have complications. Not necessarily the case, but it might happen. And it comes to my mind, the question that comes to my mind is how aware and how urgent is the perception about climate change, the spread of these infectious diseases and infectious agents, and what different localities across the country are doing to combat that, if there's any such plan or any such agenda, or if that sense of urgency is there. That's what I'd like to hear from you and learn.
Great, thank you. I think what I'd like to do is address this with mosquito-borne diseases, first of all. I don't know if you know this, but this year CDC had actually issued a notification that physicians in the US should be on the alert for dengue fever because of the rapid increase in dengue fever in Central and South America. And of course, as we know, with global trade and movement of people around the planet, people are coming into the US and going out of the US all the time. But really, the thing that we're focusing on here is climate change, because it's a significant contributing factor to this increase in vector-borne disease cases that we've seen in the last 20 years, because we're seeing rising temperatures, which makes the environment usually more hospitable for the mosquitoes, as well as extensive rainfall. And it's an interesting phenomenon with rainfall, because when you have hurricanes, you often have saltwater intrusion. And so Aedes aegypti doesn't survive that very well. But then as the waters recede and the floodwaters are still there, then we see a proliferation of the mosquito. And so we're trying to adapt to these changing risks. And we have new technologies, of course, to prevent transmission, but we still need a lot more, and we need them urgently. We have a very difficult time in much of the developing world controlling this mosquito. We use insecticides, but of course, we're seeing so much resistance now that they're becoming ineffective. We've seen, as you mentioned, recent advances in vaccines, particularly with the dengue vaccine, but we're also using spatial repellents in some parts of the developing world. And I'm not sure if you know what those are, but if you imagine an 8 by 11 sheet with a little bit in the center that has a repellent that can volatilize into a room and keep the mosquitoes at bay for a certain period of time, usually around 2 weeks, this seems to be a pretty effective mechanism. And one of the things that's nice about spatial repellents is the mosquitoes are not physically going onto this repellent. And so there's less resistance to the insecticide that's being volatilized. And so it's inexpensive and an interesting way to do this. We're also using genetically modified mosquitoes. And I know that in Brazil, they have had releases of genetically modified mosquitoes. This is where the males are sterile, and so there are no progeny when they mate with the females. But we're also using Wolbachia, which is a naturally occurring bacteria that reduces the transmission of the virus, of dengue viruses, for example. So we have a few things that we can use, but these novel adaptations are really not operational. And you know why? Well, funding is one big thing, of course, regulatory status, and of course, the infrastructure needs to build facilities to develop these mosquitoes. I mean, it's so expensive to do this that we need more buy-in from communities and decision makers, really, in order to make sure that these strategies that are emerging are utilized.
That is such a rich set of issues that you've just raised.
And it's not just, I just want to add one more thing in there, that we need community engagement as well. And that's one of the things that we're starting to see a little bit more now, which is heartening, because at first, many of these novel approaches were being introduced into communities without the community's consent. And when you do that, people are up in arms. You're releasing more mosquitoes into my community? What? What are you doing? And so there's such a need to educate people about these technologies before we actually go in and release them.
It's great that you mentioned it, because there were things that you mentioned about these existing technologies that are currently being used. And of course, nothing is sufficient unless you have buy-in from everyone, as you've just said. But some of them are really interesting. The one that you said about having the insecticide in a particular space so that it can sort of
volatilize. Mm-hmm.
Volatilize or aerosolize. Can we say that?
Yes, sure. Yes.
So aerosolize into the space, right? To control the mosquitoes, or at least to keep the mosquitoes at bay for a time. That I had not heard about that actually. But
right.
It sounds extremely interesting as an option, because it sounds like a relatively cheap way to control something like this.
Especially indoors. I think, you can probably see one of the issues with it, right? What happens when you're outdoors? And with Aedes aegypti, it's a day-biting mosquito that will bite you indoors or outdoors. It doesn't care where you are. And so we also like to suggest that people take personal protective measures so that they wear long sleeves and long pants. And, this is kind of difficult in some of the climates in which we find Aedes aegypti, where it's really hot and really humid and people are not comfortable wearing this type of clothing. We also recommend EPA repellents such as DEET or picaridin. But of course, that's often something that's outside of the ability of people to afford in many parts of the developing world. And so it's easy to say, use these personal protective measures, but we really need to come up with advances that are suitable for all parts of the world and all communities.
And before we turn to funding and to cooperation between countries, all these very difficult questions, perhaps the most difficult, I do want to hear about your work on excessive heat, because I think there's so much there, and it's such a rich set of issues that you raise there as well.
Yes. And so we know, and we've experienced so much excessive heat in the US recently, as you know. Higher temperatures are associated with adverse pregnancy and birth outcomes, which is a problem. We find low birth weight. We find all kinds of issues with heat-related exposure. Mental health impacts. We've known this for a long time. When it gets hotter, we see violence rates rise, increased emergency room visits, hospitalizations related to cardiovascular disease, related to diabetes, electrolyte imbalance, renal failure, respiratory outcomes. And I could go on and on when we talk about this. And we, of course, know that these heat related health impacts are greatest among children, adults over 65, people with disabilities, people with mental health or substance abuse disorders, pregnant people, and people who have lack of access to cooling, okay? As well as outdoor laborers. I mean, we don't often talk about that, but we
Construction
really
workers,
see,
right?
yes, absolutely exposed to that heat for extended periods of time, and migrant workers who are providing food for our tables, right?
Absolutely.
So we expect that these heat related death and illnesses will continue to increase unless we see climate adaptation and mitigation policies that are being implemented.
In these communities where you see the greatest impact of, say, either excessive heat or mosquito borne illnesses or tick borne illnesses, do you see a sense that the community clearly understands that those issues that they're facing have to do with climate change? And if so, is there a divergence in that the people who are affected know that they're being affected in part by climate change, but the people who are not affected don't feel it and thus don't look at climate change with the same focus on health as the people in affected areas? Can we say things like that or no?
Well, I think we can say we know that there are populations that are disproportionately affected, and I've gone through the entire litany of those, right? But I think that one of the things when we think about it is let's talk about air conditioning, for example. Okay. And we know that there's limited access to air conditioning in low wealth communities. We know this is a fact. We've done national surveys that show that 20% of the population may have air conditioning, but if it's broken, they can't afford to fix it. Or they may have air conditioning, but they can't afford the electricity costs to run their air conditioning sufficiently to cool themselves. Or they may not just be able to afford air conditioners, period. And I think that, when we think about air conditioning, I think it's an interesting one too, because we know that it can, of course, exacerbate urban heat islands because of the heat that goes out. But also, what it does is result in a lot of power outages. And power outages affect everybody. It's not just affecting people who are under resourced, it's affecting everybody. And so, while some people may have generators to help mitigate the impact of power outages, others don't. And so, I think it's a sobering thing to see for everybody in the community. And particularly when you look in the aftermath of a hurricane, for example, when there are power outages for extended periods of time, where people don't have power for weeks on end. And if you have high temperatures, everybody is subject to that type of uncomfortable condition.
Mary, what is the United States doing when it comes to excessive heat and all of the issues that you mentioned, the health issues that are associated with excessive heat, and they're very serious health issues? What are the strategies that the US is implementing to address this?
So I think that there are a number of different strategies that are being undertaken, but I think the important thing to remember is that many of these strategies need to be tailored to the communities that are affected. And so some government programs exist to help weatherize buildings, which of course reduces energy usage, really important for people in under-resourced areas. We're also seeing sustainable cooling strategies such as heat pumps and fans that are coming into play. And I think those are really, really important and will be in the future as well. And then I don't know if you've heard of this, but passive cooling, such as night flushing, where you flush the heat out of a building and allow the evening cool air to come in, is also a strategy. And one that I've been reading about lately is cool roofs, where roofs are being painted with a white paint that has a high albedo or reflectivity that will keep the houses cooler underneath. And this is a strategy that could be employed in much of the developing world as well, because it's a very inexpensive strategy that I think has a lot of potential.
Mary, let's now turn to something that you've already raised quite a few times during our conversation, and which is absolutely critical.
Mhm.
We know that there is an issue of underfunding in handling or addressing health issues internationally. In other words, international health efforts are drastically underfunded, especially in view of the amplification effects that climate change brings to the table, as you highlighted early on in our conversation, and particularly for diseases that are developing very rapidly. So, one thing that came to my mind as I was thinking about things that we've discussed and things that we were talking about is
Mhm.
Mpox. Mpox, previously known as monkeypox erroneously, but now known as Mpox. Mpox is a disease that's been around for a while. We've known of it for quite some time. The virus isn't new. It's an old, it's a very old virus, as all of these orthopox viruses are. But anyway, it's a virus that's been in circulation for a while. Yeah, the novel thing is the way that it's been affecting humans because it didn't affect humans as much in the past. Now it does. And yet, and we have a vaccine that presumably works relatively fairly well against this particular virus. And yet we've seen the spread of Mpox everywhere. We've seen cases in far-flung places and closer places, and it's just spreading. And even though we've been through a pandemic very recently, only 4 years ago, yet we see this situation developing without much in the way of coordination or even thinking about or planning for an eventuality such as this one. So, in thinking about Mpox specifically, but not Mpox as such, but as an example for this lack of coordination, lack of funding to address global health challenges, what have you seen while studying climate change and what can we do? I mean, in your view, how can we get more well funded international health efforts out to address the needs of the population? I know it's a very tall
Well,
order of a question.
right. And I have not much control over that. So I think that, we see the World Health Organization, right, as a prime example of an organization that is attempting to ensure there's cooperation across countries when it comes to disease control, right, to alerting the populations about an emerging disease and to ensuring that there are whatever resources are available to help with the control of that disease. We also see our own Centers for Disease Control working abroad because in the recognition that anything that happens abroad can also move to the US because there is such global movement now, whether it's from trade or people moving around the globe. And so we need to be vigilant about all of these things. And so there obviously is a need for enhanced funding for everything. We see the Pan American Health Organization working very closely with the US Centers for Disease Control and Prevention on diseases like dengue, like yellow fever outbreaks, things like this that could impact all of our populations, whether we're in the global north or the global south. Because even though there are these country boundaries, we know that these diseases can travel back and forth across countries with ease.
Absolutely. So, following up on that, one piece that I've been really interested in is the global governmental response to pandemic preparedness. And what do you think that governments would need to do to help ensure that we don't have another potential pandemic? Well, this is kind of impossible, but at least a potential pandemic that is very clearly going to come from climate change. Like, for instance, the spread of some of these vector-borne diseases that we talked about, or something else entirely. What do governments need to do? And how should we be approaching this? What is it that we're not doing? What are we not doing?
So I think the number one factor is we need to enhance surveillance. And we have very limited surveillance, I'm going to say, in areas, for example, along the US Mexico border. I mean, there is a border protection agency, there is a border infectious disease program, but there needs to be increased surveillance for all of these diseases. And there are labs that are funded by, for example, EcoHealth has a number of labs, I think 40 labs around the world, where they're investigating emerging viruses. And it's really critical that we continue to fund these types of efforts to ensure that we are at least half a step ahead of what's coming down the pike. And governments need to be prepared. What are the steps? The current administration has established a pandemic preparedness group. And so they are working on developing this. But we also need to ensure that there is cooperation among countries. We saw with COVID-19 that there were charges back and forth about whether or not we were seeing transparency when it came to divulgence of all the issues around the virus. And so we need to ensure that scientific agencies are transparent with one another.
So, you've given us so much information, so much valuable information that I just have to ask you, what is it that you would really like everyone to know about climate change and health?
I think I'm going to just reiterate what I first started with, that climate change is not just affecting our physical health. Okay, I think it's really important for us to understand that we're seeing negative effects on our mental health, on our spiritual health, and on our community health and well-being. And so we need to focus on strategies that are both adaptive and mitigative. But we also need to focus on ensuring that all communities are involved in the decision making, that we are doing a top down as well as a bottom up approach to this. Because if we expect any of these efforts to be sustainable, we need to involve all communities from the outset.
And in your view, how important is it that perception shift from viewing climate change as a motivating factor for energy transition, which it is, as a carbon emission reduction necessity, which it also is, but how important do you think it is to have the public health aspect in there? So, in other words, when you think climate change, you think carbon emissions, you think energy transition, but you have to think public health.
And I think we're starting to see that shift in our population now as we see more and more of these extreme events that are fueled by climate change. I think people are recognizing that public health is of the essence. If we don't have our health, we really don't have anything.
Thank you so much, Mary. It was wonderful to have you. A lot of rich information, a lot of very valuable information. And thank you so much. Thank you for giving us your time.
Well, and thank you, Monica, for all your really thought-provoking questions. I really appreciate it. And I appreciate the opportunity to expound on one of my favorite topics, mosquito-borne diseases. So thank you for giving me that opportunity.
Thank you for joining me on Policy for the Planet. Have a question or a topic to suggest? Email me at podcast@piie.com. I'd love to hear from you. Don't forget to rate, review, and subscribe to Policy for the Planet today so we can keep this podcast going. And even better, please share our show with your friends and colleagues. Special thanks to Jennifer Owens and Alex Martin, our producers, and Melina Kolb, our supervising producer. This podcast is brought to you by the Peterson Institute for International Economics. Learn more at piie.com. Until next time, here's to creating meaningful impact. Stay motivated and stay curious.